the timeline of Medicaid cuts from the federal budget bill, also known as the Big Beautiful Bill, brought to you by Whole Washington for universal health care in Washington State. Before we get into it, for Washington State, Apple Health is the same thing as Medicaid. Changes are happening to both the Affordable Care Act and Medicaid. The timeline stretches from July 4th, 2025 to January 1st, 2029. The changes are going to be spread out over 8 different dates. A few excellent visuals from the New York Times. Please check the description for the link to this article. It is excellent and very worth going through all 10 graphs that they post. What is being publicized right now is that work requirements are a very high percentage of the cuts. However, it's less than a third. There are actually way more cuts that haven't been talked about that much, including repealing rules for eligibility, limiting payments to the providers, making it more difficult for states to fund Medicaid. Medicaid cuts are $841 billion. It's actually likely a little more than that. This was for the House plan, and the Senate plan actually has more cuts. It's less than increasing the standard deduction costs. Starting with July 4th, 2025, are changes that went through right away. First, inpatient hospital and nursing facility services will now be capped at 100% of the Medicaid payment in Medicaid expansion states, which includes Washington, and 110% in non-Medicaid expansion states. Some grandfathered in payments will start changing in 2028, and we'll cover that in the changes in 2028. It will eliminate the Biden-era rule for long-term care staffing requirements. There will be more patients per caregiver. It will prohibit Medicaid funds being paid to providers that are nonprofit organizations. This is particularly targeted at Planned Parenthood and other family planning services. Moving to January 1st of next year, 2026. The federal government will disallow the Medicare premium tax credit to non-citizens. There will be a creation of a rural health transformational fund to help rural hospitals, and this will be $10 billion per year. This is estimated to provide about 1/6 of the losses from the cuts to Medicaid because rural hospitals disproportionately rely on Medicaid for funding. Open enrollment window now ends 1 month earlier. So anybody open enrolling in Medicaid or state plans that are based on Medicaid will now have less time by a month. There is no longer year-round enrollment for people with incomes up to 150% of the federal poverty level. Auto enrollment is eliminated across many Medicaid expansion provisions, including eligibility. People must prove that they are still eligible and getting the tax credit. Moving to October 1st, 2026. Illegal aliens or non-citizens can no longer receive Medicaid benefits. There are provider tax changes, which is important for states to fund their part of Medicaid. And this provision does not, thankfully, affect Washington State. Moving to January 1st, 2027. This is a big date. There's a system for reducing duplicate enrollment. Eligibility redeterminations for Medicaid go from yearly to every 6 months. States can go even more often than every 6 months if they so choose. And now to the Medicaid community engagement. It will cost $200 million per year to administer. So you have 2 options to show community engagement. The first one is to have 80 hours of work, community service, or work programs, or a mix of these per month to show that you are engaged enough to receive Medicaid, or at least half-time participation in an education program. The look-back period for determining eligibility for Medicaid will be cut to 3 months. Only parents with children ages 13 and under are exempt from this community engagement requirement. And on the state, gender-affirming care is prohibited for Medicaid recipients. And yes, it is intentional that the biggest changes from this bill are happening right after midterms. October 1st, 2027 changes. It reduces the expansion match rate from 90% to 80% for states that cover lawfully present immigrant children and pregnant people. January 1st, 2028 changes. States who pay more than the Medicaid payment for inpatient hospital and nursing facility services, this is back from the changes that happened very early on, but have grandfathered payments now have their payments reduced by 10% yearly until it is in compliance. Reducing these payments will limit the amount of places that actually accept the Medicaid payment because the Medicaid payment will be lower. Home equity is now limited to $1 million when qualifying for Medicaid long-term care. And the weird part about this is that this is no longer adjusted for inflation. States are now required to do more checks on providers. This is just more paperwork for both hospitals and the government. And it is monthly for enrollment and eligibility, and quarterly to check for dead people or other kinds of fraud. So when people say that this bill is designed to go after fraud, they're talking about this date and this provision. October 1st, 2028 changes. Medical premiums of up to $35 go into place for Medicaid users between 100 and 138% of the federal poverty level. There is still a 5% of family income out-of-pocket cap on spending. There is a change in home and community-based service eligibility. And now for a little bit of good news, there is a chance that states will get exemptions from the 2027 changes, the community engagement requirements and the other draconian changes in there. It's possible Washington State may be able to push off some of the worst provisions by slowly transitioning, but they will need to finish transitioning by the state. In light of these cuts, we need to rethink healthcare. In Washington, we have the Washington Health Trust. The Washington Health Trust would provide to all Washington State residents comprehensive coverage: dental, vision, hearing, prescription drugs, reproductive health, mental health, and gender-affirming care. There would be no premium, no deductibles, no copayments, no medical bills, and prescription drugs would be capped at $250 per year. Want to help universal healthcare succeed in Washington? Check us out at wholewashington.org. Pledge to sign our initiative, sign up to volunteer, donate to our cause, or attend an event like an all-volunteers meeting to learn more about the organization. And I hope to see you there.